Hello, and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are going to be talking about the Lake Haven Behavioral Health Unit up in Henry County. And here with me to discuss it is Shelby McMillan. She is the director of Lake Haven Behavioral Health. Welcome to the show, Shelby.
Hey, Kara. Thank you for having me.
Thank you for coming on. So you came all the way here from Paris, Tennessee.
I did.
I've been having a lot of the Paris folks coming up to the studio.
Yeah, they said it sounds better in person, so we want to make sure we sound good.
So this is my little setup here in Jackson. So West Tennessee Healthcare just recently acquired the Henry County Medical Center, and now it's the West Tennessee Healthcare Henry County Hospital. And so we've been getting to know a lot of the people up there. And so this particular unit, the Lake Haven Behavioral Health, we want to get to know a little bit more about that. So first of all, I want to get to know you and your role here as the director. So you can start by telling me a little bit about how you got into the healthcare field and your role here as the director.
Well, sure. I actually went to school to be an English teacher and an art teacher and several other different things. I never really knew what I wanted to do. And then I went back to school and became a nurse because I needed a job. It's kind of what it boiled down to, Kara. But I really while I was in nursing school, I fell in love with psych. And I ended up in Paris, Tennessee, and I started on med-surg, but they had a psych floor. And when an opening came available, I put in a transfer. And after about a year, I got up on psych and worked. And I've worked there ever since. And then I've been in my current position as a director of Lake Haven for about 2 years. Okay. So I was a floor nurse prior, and then now I've been the director.
Oh, nice. I always like to hear how people arrived to the role that I'm interviewing them for. And you started out in very creative roles, which is kind of what I did. And then I sometimes think about, because I'm interested in healthcare, but I'm not clinical. And I'm like, when I think about going to nursing school, I worked at a scrub shop for a little bit and I had to help nursing students and they would just be like, it's hard. So I'm like, maybe not for me. Yeah. Math is not one of my things.
You could do it. You could do it.
That sounds like, but yeah, just having that interest in like going into that field. Because like nursing, you kind of have to be very passionate about what you do.
Yes, you definitely have got to like people. You have to like to talk to people and be around people.
So, So the Lake Haven Behavioral Health Unit, talk to us about the important role it plays in the region. How long has it been there?
Sure. Lake Haven has been around a long time, actually. It is an inpatient psychiatric unit. Right now, we have got 10 beds, and we serve 18 all the way up to 118. We serve everyone. But our goal is to separate the populations, have the adults on one unit, and then our geriatrics, meaning like 60, 65 and up on another unit.
Right. So for listeners who may not be familiar with what exactly is a geriatric psych unit and why that's so vital for older adults in the community.
Sure. It is for older adults, or it could be based on diagnosis, dementia, Alzheimer's. Mm-hmm. When you have those family members or friends that have issues with confusion or wandering or behaviors, aggressive behaviors. It can be many different things that you kind of need help with. That's what we're there for.
Right. Now, it was closed during the pandemic, I'm told. So what was the decision to, kind of reopen it to now?
Yes, it was closed. It's been closed, I guess, going on 5 years.
Oh, wow.
I know. It doesn't seem right. Just basically a need for it in the community to get it back open.
When did it actually come back open?
I guess technically we still have a geriatric psych. We're just all on one unit.
Oh, okay, yeah.
So it's just, there's a need to kind of separate that to better serve the populations.
Right. So can you walk us through, kind of what a typical day looks like for patients in the geriatric psych unit?
Sure. So in the morning we have breakfast, try to get everybody up and move in for breakfast. The nursing staff will pass out medications during that time. The provider will see the patients every day.
Oh, okay.
And make rounds on them. We have groups and activities by our wonderful activity therapist, Miss Kendra Pate. And then we also have social work groups by Miss Sarah Scott. They do that.
Okay.
And we try to keep them busy. Our unit, there's no TVs in the rooms. We kind of promote community by having an activity room that has a TV. So we try to promote everybody kind of getting together and getting out of their rooms.
Yeah, I was going to say not isolating.
Yes.
So are there any specialized therapies and services available to the patients and their families? I know you kind of mentioned, that there's like activities and things.
Yes. So being a part of the hospital is a great thing because we have our wonderful physical therapist who can come up
Right.
there and work with patients if they need physical therapy. We also have wound care.
Okay, right, yeah.
That they
That's
can
always very
also,
important.
yes, they can also come up there and help out our patients. Speech therapy, dietary. We have access to all of that to help our patients out.
Right. And I mean, having it be part of the hospital, I feel like is maybe different from some other like assisted living or facilities or anything, since it's part of the hospital. Like those roles and those like the PT and the wound care is kind of maybe built in or something.
Yes, I mean it's a great thing to have them there, and
That it's easy to just try to.
Yes,
And I guess all the systems the same, so
yes,
it's
easy
an easy
to
transition to kind of bring them over from the hospital to check on
exactly
people in the unit, right?
Easy to manage their medical issues,
Right.
as well as the psych.
Now, this is the only geriatric behavioral health facility of its kind in Henry County. And we kind of touched on this, but how do you see this reopening helping fill a critical gap in care here?
Oh, it just allows the community to have access to help for the geriatric population.
Now, as far as you and your team, how do you guys feel about bringing this back? Like how was it discussed and how did you take that to say, oh, great, like this is coming back?
I think as a whole, we realize the need for it in our
Right.
community, and just having that specialized care for them to help them out.
Right. Now, especially, a lot of times with this kind of unit, people are maybe they don't understand as much. They don't have as much information on it. So for families who may be nervous about seeking help, what would you say to reassure them about the care that their loved ones would receive in this unit?
Yeah, so our unit is a locked unit.
Okay.
So if you do have a family member or friend who's wandering, you can take ease that they just can't wander out.
Right.
But that we provide, we can't cure, there's no cure for Alzheimer's or dementia or anything like that, but we can provide medication that can help manage the behaviors for that, the wandering, the confusion, the aggression, the agitation, and provide them with that. And they can rest assured that we do take care of them.
And I mean, I know I've interviewed someone here with like there's something about having a community around them not being isolated in a home by themselves or without structure of some kind that kind of helps the mental portion. So having the community of the other people in the unit itself can help.
And
with.
for families that are taking care of these loved ones, it can be very
for sure.
exhausting because a lot of times they get their days and nights mixed up, or the wandering, or the not eating, or I mean, there's a lot of different or the aggressive behaviors. So it kind of, not to give them a break, but in a sense, it does give them a break. And
to just have, like you're having to try to do your own life and having to deal with this, and you're not trained. You're doing a completely different job. And this is your loved one too, which makes it even more difficult.
Exactly.
So having the resources and having a place that they can go with people who are specialized and trained in this.
Yes. And we're there. The nursing staff can watch if they're having any medical issues or side effects from medications. We're there to take note of that and get the help if they were to need it.
Right. And so, if you have a loved one in the geriatric psych unit, how can families stay engaged and involved with their loved one while they're in the care of this unit? Because I know some people, they maybe feel bad about putting them in a place.
Oh, yes. We do have visitation. They can call anytime. We're there 24/7, 7 days a week. And they can visit. We have visitation, the phone times. They can talk with them.
Right, yeah.
And then our social worker is usually in contact with them, our nursing staff.
So you're not just handing them over, I guess. You're doing what's best for them and for you, for everybody's mental health.
Exactly.
Because, I mean, your mental health as the caregiver, as the loved one, is important as well.
Is important too.
And do you have any advice that you would say for someone who feels that way, that they're like opposed to handing them to a home?
I think it is a hard decision. Sure, if it were my family member, it would be hard, or my loved one, it would be a very hard decision. But knowing that they're in a safe spot, safe place, they're getting the care that they need, you're getting the rest that you need, and getting the person help that they need.
Because especially like you said, with people that wander, I mean, that's a big thing with a lot of these dementias is it causes people to wander. And you're not the one that's having to get the call at work that someone found your mom or your grandma, 2 blocks down the road. That's such a awful feeling to know. And so, yeah, having that, it's a hard balance, but you're doing yourself and your loved one a favor by helping them not get themselves into harm's way, I guess.
Exactly. Yeah.
Right. So if someone thinks that their loved one may benefit from admission to the geriatric psych unit, what would they need to do to kind of get that process going?
Sure. A lot of times with our geriatric population, they do have to be what's called medically cleared. So we kind of direct them to a local emergency room, or they can go through their primary care provider, to get cleared, to make sure that there's not something medical that can be causing this confusion or these issues. And once they're deemed medically clear, they can just come right up to the unit. They can give us a call.
Okay.
They can have their primary care call us. They can call us themselves.
So there's multiple different ways.
There's several different ways to get them admitted.
And are there any particular signs or symptoms you recommend families, to kind of be on the watch for that might indicate a need for this type of care?
Yes, like we talked about, that the wandering, the aggression, the not eating, the not drinking, the increased confusion, increased falling can be another thing.
And that's another hard thing, that the people that fall try to downplay it. So you I feel like maybe need to watch out for signs that they have fallen and that they're maybe trying to not tell you about, like any bruising or something, I guess.
Oh, yes.
Because I know a lot of times with people, they don't want to admit that they're struggling. I know that's a really hard thing for people.
It is.
So looking ahead, what are you most hopeful about as you welcome patients back into this space?
Well, I'm just looking forward to being that resource for the community and helping out our geriatric population and their families and getting them the care that they need and helping them once they decide to leave us as well.
And I mean, we just talked about kind of all the more negative or upsetting parts of it. But we want to make sure that this podcast, talking about the Lake Haven behavioral health as a positive thing to help people.
It is a positive thing.
Right.
We're there to help. A lot of times things get worse before they get better.
Right.
And
it's like once you know that there is a need, that you have that resource available,
and
that you're not alone, and you're not, if you're struggling to say, what am I going to do? How can I, help my loved one, especially? You're just trying to get them help and just help everyone in the process.
Yes, help them and their families, for sure.
Do you have any personal real life experiences where you've seen the help that someone's received, or, a loved one maybe saying, that they're glad that they took their loved one to go to this unit? Have you talked to anyone that's experienced the difference?
Yes, I think it's throughout the years we've had the geriatric population that we've dealt with. We've had people as young as in their 40s that have some dementia set in. And a lot of times families are in denial. They think it will get better.
Yeah, they're hesitant, I'm guessing.
Yes, they could be very hesitant. But a lot of times we have to talk with families that, we just kind of got to manage the behaviors.
Right.
And in time, we do see people that get the care that they need. The family is able to get them placed at a nursing home or at least get home health set up.
Right.
And the behaviors are managed. They're not wandering or aggressive or agitated.
Because you're just trying to go from, this is the situation to how can I make this as best as it possibly can be.
Exactly.
So is there anything else you want our listeners to know about the Geriatric Psych Unit or Lake Haven's broader behavioral health services?
Yeah, so Lake Haven, like I said, we are our inpatient psychiatric unit. We serve 18 all the way up. We do take direct admissions if you are of the younger population and don't have a lot of acute medical issues. We do that. You can give us a call, 731-644-8420.
So I will definitely include that phone number in the show notes of the show so that we'll have that written down as well so people can call that.
Yes.
And I mean, can they call that number just to inquire, like if they just have questions about, what would it be, how that all works? And with insurance too, I'm assuming that all can be answered over the phone.
We can answer it there, and then they can fax us too at 731-644-8424.
Well, thanks so much for coming on, Shelby, and telling us all about the Lake Haven Behavioral Health there in Henry County and all the great things that it does to kind of help the community up there.
Yes, great, Kara. Thank you for having me.
Yeah, thanks for coming on. Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.